Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday for your Monday morning update as promised. First thing I'd like to talk about is, this is a team. Our industry is a team. We can't be seen as competitors anymore. We have to be an army of insurance agents willing to stand up and fight for what's right. You've heard me talk about the fact that there are agents, and according to the CMS algorithms, they're minority agents in most cases, are being targeted. They're losing their access to their book. They're losing their income. They're guilty before being proven innocent. It's good agents. They're good agents. They're working with me, they're working with Dicer's Law, and they are fighting, and we're fighting to get CMS to stop. But what I would like to say is that I found out something that has caused a ruckus on Facebook. One of the questions that was asked by Dicer's Law by some of their clients is, if I lose my book, my ACA book, my certification is pulled, I'm guilty without proven innocent, do I lose my Medicare book? I reached out to CMS, and do not kill the messenger. I'm tired of people thinking I'm lying and that I do not have connections and I don't know what I'm talking about. But when I talk to CMS, I talk to them directly. I'm not going through other people. They said, yes, you lose your Medicare book also. So this does not affect you if you're not registered to sell in the ACA. This does not hurt you unless you sell ACA, you have a book of business, and CMS has said, we are pulling your certification and you can no longer sell nor touch your book. If that is true, they also are going to take your Medicare book. But the good news is that according to CMS, this is not their intention. Their intention is not to take your book for Medicare. That you just simply have to send a specific paragraph to the FFM help desk, which I was asked not to send it out to everyone, just to those that need it. So if you have lost your ACA certification, you're concerned about your Medicare book, if you'll just reach out to me directly at HAFA@HAFAamerica.org, we will make sure you get that paragraph to get your Medicare reinstated. So yes, it is true. No, I'm not making it up. It is what it is. But you can get your Medicare book back. So absolutely, let me know if you need it. We're in the middle of open enrollment. We're 4 days in. There's a lot of things happening. I'm getting some mixed bag emotions about the Health Sherpa's Resume link. I had a horrible experience. It sent my client to healthcare.gov and made them go through the whole application. The girl was so confused on what an HRA was and what she had to do that she was in tears between her cussing. But I've heard other folks say that it was easy. They sent the link and it was not complicated. I've also heard that those that have communities and clients that do not speak English, cannot read English, are sent the link and they have no idea what to do. In that instance, you're going to have to make the three-way call. But I will repeat and continue to repeat, when you make that three-way call, if that call center tries to sell your client another plan or tries to sell them dental, report them to your state Department of Insurance. They are working without a license. And I'm going to say that with a caveat of something that I just noticed. The client that I helped the other day said, I called the Marketplace Direct, I called healthcare.gov, I wasn't really sure what to do. They enrolled me, but I want to be enrolled by an agent, so I'm calling you and I'm asking you to help. on that client's application absolutely 1000% has an agent with an NPN number. Now, if she called healthcare.gov and if it is manned by non-licensed people that are not encouraged, not commissioned, that we've always questioned, why is there an NPN number connected? Something I'm asking CMS about. I've had 2 complaints so far about agents using the Health Sherpa marketing link and renewal link that sent them to a Health Sherpa agent that took them off the application and put a Health Sherpa application agent on it. CMS is looking into that also. Just know that I'm here, and if something happens wonky, you need to let me know. I told you last week I was going to meet with the Speaker of the House staff. I did. We talked about all the overreach of CMS, about the fact that people are losing their books of business. We talked about the fact that Medicare Advantage is being allowed to not pay commissions after they've filed rates. We've talked about Medicare Part D not paying commissions. And I want to do a little bit of a deep dive on the Medicare Advantage rates. For those that don't understand the rate filing process, carriers have to file their rates with CMS. CMS reviews those rates and approves those rates. So if those rates include commission prior to open enrollment, they include commission after open enrollment. A carrier cannot arbitrarily decide that they do not want to pay commissions and they have now decided they're going to keep that money as profit. It should not be allowed, and I'm calling on CMS to make a decision to correct the carriers on this. It's not allowed. It's against the law. It's part of the rate filings. They cannot do it. So I get very frustrated when I see folks on Facebook say things like, why are you worried about that? You can just go sell something else. You know, we shouldn't complain about carriers not paying us. We should be fine working for free. There's no other entity in the United States that I'm aware of that works for free unless they're considered volunteers. No profession is asked to work for free. We shouldn't either, and you shouldn't either. So if you have the mindset that you're not going to worry about someone not paying you commissions, well, you have more money than I do. But my agents that are out there that are working, that need Medicare Advantage commissions, and they need Medicare Part D commissions, they need it and they deserve it. It's not right. It's criminal. It is simply criminal. And do not think that I'm not emailing and faxing letters and information to those on Capitol Hill about what's going on. You should too. I know you're in the middle of open enrollment. I know it's really a busy time, but if you have a second, I put the link on Facebook. Send them a quick note. You shouldn't be asked to work for free. Absolutely shouldn't. It just makes me so mad, and it makes me angry with the people that are not part of the team. They're part of the I, and they're not part of the team. And there's not an I in the word team. We are a team of ninja warriors, and we deserve to be paid. And you deserve someone to fight for you, and you deserve a bulldog that does not give up. And I will not give up, I promise. I'm going to a meeting this month with the National Association of Insurance Commissioners. You can promise I'm going to be in front of as many as I can about those marketing reps selling plans without a license. And then even more, if those marketplace reps are licensed agents, we have a bigger problem than I thought. But just know I'm here. I'm fighting for you every day. I have a small book of business, so I'm working open enrollment too. That helps pay the bills, just getting that little bit of commissions that some people do not think that is very important. But I love every one of you. Thank you for everybody that sends me the information that they receive. I know that a lot of you are having problems with the Georgia Access Exchange. I keep saying state exchanges are not always the best. They're having a lot of problems. They're having problems with Oscar. Just know that I'm going to be reaching out to them too. And I will be meeting and chasing down the Georgia Commissioner of Insurance in a couple of weeks in Colorado. So kind of long-winded today. My apologies. A lot to say, a lot of anger, but have a great day. And don't forget, Wednesday is our HAFA Power Hour. If you can join, I'll do a deep dive in things that I can't say publicly. Have a great day.